Manaka, and welcome to our final segment of Speak Your Mind. I'm your host, Serafina Wedlock. Now, kickstarting the Speak Your Mind show that that I had the pleasure of hosting last year, October introduced our guest today. Now, this is when the Empowering Women project kicked off with the VCSA Sai Health Center, Health Clinic. Now, we've got them again. It's only befitting that we have them to close my final segment for today. But yes, in studio with us, we've got the Health Promotion Officer, Mr. Moses Mbasese of the VCSA Health Center. And we've also got Dr. Professor Rajineshwar Ganeshwar, who's also the head of the Department of the Gynecology and Obstetric Fiji National University as well. And he's the medical director as well at the Health Center. Gentlemen, good afternoon, and thank you so much for joining us.
Good afternoon. Thank you for having us.
Okay, Mosese, I believe you were part of the health promotion officer of this project. Tell us a little bit more about the project from when it first, when it started. I believe it was September last year until this year.
It started before that.
Okay.
September last year was the Pink October. We were gearing
That's
up to
right.
Pink
That's right.
October. But so far, from the experience of the health promotion unit of VCSA Sai Health Center, I think one of the elements that will continue in terms of health is the area of education.
Right.
And education has a wide area of coverage, and the main aim is to change attitude and also to change mindset, and overall to change the behavior and how people improve their health from hygiene and sanitation, and then it goes on to reproductive health, as well as non-communicable disease and the promotion of wellness at all spectrum of all the programs that is being done.
Right.
And so far, the response from the community has been good, from the reproductive health program and also from the non-communicable disease, as we are trying to promote wellness and prevent NCDs. And the response from the community, from community leaders, has been wonderful. But it doesn't mean that the work ends there. It continues. The area of education, as I said, will have to continue in years to come with the new generation coming up. This aspect of learning, aspect of prevention, preventative health is very, very important.
Now, what did the whole project entail? Like from kickstarting when it started. Before that, this had to have a lot of community relationship with the community at large. What was the logistics behind it? Was it quite hard trying to get people to come for the clinics that was conducted by the health center?
I guess one of the first issues that VCSA Sai Health Center did was doing community meetings,
right,
and to promote the health center and the programs that it was going to do. Yes, it can be a challenge to try and rope in people. It can be a challenge to try and take the message into the community, because people have different views regarding health, and people have different perceptions regarding health, different personalities as well. And that can be a barrier in itself. But the initiative took a change when we did advocacy with leaders, community leaders, and try to work within the frames of the community organizations that were already in place.
Right.
This creates a lot of difference. And the experience in VCSA Sai Health Center, that even though at some places it's difficult, but it is not that difficult if they are part of our stakeholders, if they are part of the problems. So they need to be part of the solution as well.
Exactly.
So talking to the Turangani Koros, talking to the advisory counselors, talking to the Tikina councillors, and to the level, now we've gone as far as the Bar Provincial Council, just to emphasize on the importance of health. Having their say is something that is very important. Having them get interested, because this is something that is always secondary to, especially in the Itoke setting. The mentality of Itoke men is that health is always a secondary agenda. And that is one puzzle of it. The other puzzle is, if we go into the Indo-Fijian community, it has its own different story.
True.
The sugarcane belts are now changing. I remember you were there in Soweni.
Exactly, yeah.
And the whole area that used to be cane belt is gone. The community that used to be there before has now sort of disintegrated.
Mm.
So that is a challenge that has left us to try and make a way how to get into this community.
True. Doctor, what has from when the project has started until now, have you seen a big change towards from people's their mentality towards their health now?
I think it's too early to judge
Too
that.
early.
But what we have experienced is a greater sense of welcome,
Mm.
and I think people are beginning to understand what we're all about. So most recently, for instance, Mosese being at the meeting of the Bar Provincial Council and participating in the workshop that preceded the meeting is a sign.
Mm.
We've also been invited by the UNFPA and the Ministry of Health to participate in a meeting on repositioning family planning in Fiji. Then even more recently, there was a meeting hosted by UNFPA and the SPC of permanent secretaries of health and ministry officials, where they discussed issues pertaining to family planning, sexual reproductive health.
Right.
So Visesi was invited to participate in that. What I think has been of particular benefit, particularly with somebody like Mosese in our team, is that Mosese has got great contacts.
Mm.
And one of the things that he's been able to do is get us multisectoral support. So as far as our programs are concerned, we work very closely with the Ministry of Health and with the Fiji National University. But we've also reached out to the Ministry of Education, to the Ministry of Women's Affairs, to the Ministry of Youth and Sport. So these linkages have been very useful.
Of course.
Then there are, of course, the faith-based organizations. And this has helped as well in getting out to people.
Nice. We'll talk a little bit more about the program and also the project itself, and we'll have more for you. If you have calls for our in-house guests or our in-studio guests, feel free to call us up. 3220-906 or 907 is the number to call, or you can even text us on 825. Welcome back to Speak Your Mind. And yes, we welcome your calls if you have questions for our guests. 3220-906 or 907 is the number to call. Or how about you text us on 825. Now, Mosese, the project of the VCCXI Health Center. Now, one of it was empowering rural women and girls. Now, why was this important to the VCCXI Health Center? Why that particular project?
Both on that. I think for me, on a personal note, I see that this empowerment of women is something that is known world over. It's not only in Fiji, for that matter. And my background before joining VCCSI Health Center was on reproductive health education. And majority of the investment that was done in the past was for the empowerment of women on their knowledge on basic reproductive health information and the services as well. So as for Fiji, I think I don't have the stats here at the moment, but I do understand that there's 1,500 cases average each year on teenage pregnancy, and it's the same case for this year. It has gone another notch up, and that in itself shows a significant disempowering factor for younger girls.
Yeah.
So the ramification of that disempowerment continues until they are older. You know, their dependency mode to their parents and also to their spouses, and if they are being deserted by their would-be partner, you know, it creates a lot of chaos, and that is just one section of it. But it is this is something that is continuous. It is a vicious cycle that needs to be arrested.
Exactly.
In one way or another.
And Doc, what is your take on this?
Well, my wife and I have spent about 70 years in women's health.
Yes.
And in clinical women's health, what comes out very strongly is that women tend to be very disempowered about their reproductive health. understanding how the body functions, understanding the risks that the reproductive tract um, has to offer. So we, from a real experience base, felt that the only way to address some of these issues was to go down to the grassroots and talk to women and girls and empower them with knowledge, give them an understanding of what is required as far as looking after them is concerned. The whole issue of reproductive health goes back, and empowerment goes back a long way. It was Margaret Sanger in the United States in the 1930s who first popularized family planning. And she actually was the founder of the Planned Parenthood Association.
Right.
She also was one of the initial funders, in part, of the development of the oral contraceptive pill by a man called George Pincus. And at about that time, there's the Grafenberg ring that was being made in Germany for intrauterine device methodology. So the empowerment debate in women's health has gone back a long time. And I think the resurgence of it occurred after the ICPD conference in Cairo in 1994, which took away the agenda from socioeconomic reasons for family planning and population dynamic reasons for family planning, more to a rights-based approach. And the rights-based approach basically says every couple should have the ability to enjoy their full sexuality and plan to have as many children as they wish to have, but at the same time avoid unplanned pregnancies, sexually transmitted infections, and diseases associated with the reproductive tract. So this move in 1994, I think, was a great move, and we've embraced what reproductive health means in our daily work life.
That's right. Now, I'm looking at the statistics. Now, the total number of people educated was around 8,000. And you also had teachers' workshop. Now, what did the teachers' workshop entail? Was this facilitating the teachers on how to teach sexual reproduction in school, or what was involved in that?
That's one way of looking at it. But the teachers are the best vehicles to take the messages out to the students. The primary concern were the students, as well as the teachers there as well. But we were trying to get the reach in the Ministry of Education. Now you cannot go into schools without any formal qualification or any approval from the Ministry of Education. So the project took a twist in educating teachers in reproductive health, so that they can have an impact to the students that they are also teaching in school. And we also wanted to help the schools who are also undertaking family life education from the RH perspective, reproductive health perspective.
Yeah.
And the commitment from the Western schools has been superb. And we would like to thank the Ministry of Education for that matter, to the Principal Education Officer Lotoke Sawe Nandi, and the Principal Education Officer Ba and Tabua, for giving us that opportunity to reach out to the teachers. So we hope that through this empowerment, and we hope that this is going to continue as well, through this empowerment, that they will be able to cope with the changing trends of adolescent health today.
Exactly. Now, how did the teachers take it? Were they welcoming to the idea of them being educated so they can take the education to the kids, or were they a bit hesitant?
Well, it varies. I remember back about a decade ago, when we talk about reproductive health to the teachers, it's a no-go zone.
Exactly.
They say that's not our turf, that belongs to the parents.
That's right.
So now it's changing because the curriculum from the Ministry of Education is also inculcating issues on reproductive health.
Nice.
And it's part of the class 8, class 7, year 8, year 7, and year 6. And it's going further down now. So they are now inculcating reproductive health messages in the lessons. So the teachers will have to go according to the changes that is now being made by the Ministry of Education as well. So that's the beauty of it. But the challenges remain with own biasness of different people. But that's normal.
Exactly.
But the issue at hand, the statistics speaks a different message altogether.
Right. How important do you think it is, doctor, that this has to start from education has to start from the children level?
Well, both the UNFPA and the Ministry of Education must have recognized the importance of this. And they have an excellent package in the Family Life Education Program. The Family Life Education Program is about equipping children to deal with life and living better. And sexual and reproductive health is a fairly key component of this. But as with everyone, sexual and reproductive health tends to be a fairly sensitive area.
It always is.
Many of us find it difficult to talk to our own children about matters relating to sex. Teachers have not found it easy. Parents don't find it easy. So in these workshops with school teachers, we have an opportunity to raise these subjects and talk about ways of dealing with them without losing a sense of confidence and feeling embarrassed. So I think the response from the teachers has been excellent. I mean, last Friday we were at Xavier College in Bar. There were some 50 school teachers from primary school and secondary school, and not all of them were involved in Family Life Education Program, but we had an exciting day.
I'm sure. We'll have more for you, and we'll talk a little bit more on this, so don't go anywhere. You're on Speak Your Mind. Welcome back to Speak Your Mind, and we're talking to the VCSA Psy Health Center, the project on empowering rural women, girls in reproductive health that commenced in January 2013 and to date. Now, what is a normal clinic day for this particular project? What is it? How does the team go about go about your clinic days, Doctor?
Right. What we have are outreach clinics. And the reason for the outreach clinics is that many of the women we are targeting find it difficult to access current health services.
Right.
And one of the big discoveries in our program has been that if you want to make an impact in sexual and reproductive health, particularly in the rural areas, then you must reach out to communities that otherwise can't access. So our team goes out 2 to 3 times a week. They generally go out in 2 vehicles. The team varies from 5 to 7. The team, 2 members of the team go the day before to the community involved to canvass the fact that the team will be there.
Right.
And when the team goes there, the team provides clinical services either in a caravan or a tent so that the environment has privacy and a sense of security and confidentiality. And the clinical services of breast examination, pap smear, and a health checkup is done by a staff nurse, and Professor Swaran Naidu is generally with the team. She's a specialist gynecologist. But prior to the women accessing the clinical services, there is a fairly intensive one-to-one and group education program. The team has gone to areas like the Nasori Highlands, Kasim, Bukuya, and have now moved from Nandi and Lautoka towards Bar.
Nice.
The aim is to go to communities which normally would not have easy access to healthcare. What we try and do when we go out to these places is we work collaboratively with the Ministry of Health and the subdivisional staff, ministry staff. We work very well with the Divisional Medical Officer Western.
Yeah.
so that whatever we're doing is collaborative. We also take 2 medical students with us so that the medical students get some experience on primary health care as well. So far, there have been about 135 outreach visits.
Wow.
Over 9,000 people have had some education. They're the latest figures. And about 4,500 women have had clinical services. There's been an upwards of more than 2,000 pap smears performed. And about 60 women have needed to be referred for further treatment because of significant problems. And the important thing about this is that about 30 women have had either severe precancer or early cancer of the cervix.
Wow.
And by early referral, they can be cured.
That's a good thing. That's the good thing about these clinics, isn't it?
Absolutely.
And most of them, I believe, were first timers.
That's right.
Yes.
If there wasn't if the clinic was not taken to them, they would not even have figured this out.
That's right. And I think that is what is so important. I mean, it fits in with the ethos of Visesi Sai Health Center, which is love all, serve all.
Yeah.
And that's why we want to reach out to the community which otherwise would not be able to access care.
Exactly. The other thing, you also mentioned that you did this hand in hand with NCDs and educating them on NCDs. Were you able to kill 2 birds with 1 stone in this particular project? How did they react to the NCD education?
Kill isn't the right word to use in this context.
Saving, or maybe saving
Because
2 birds with 1 stone.
Because NCD is a major killer.
Yeah.
And similarly, unplanned pregnancies, ectopic pregnancies are major killers in Fiji as well. But yes, I think you make a very good point. I think one of the things that we're learning is that we should be combining the 2 packages, the sexual and reproductive health and NCDs, because women are at greater risk of NCDs as are men. Obesity is a major factor for women and for young girls. Undiagnosed diabetes, undiagnosed hypertension are major issues as well. So the NCD package that includes cervical cancer as well can all be packaged under sexual reproductive health NCDs. So I think in the next phase of the projects, as the current projects finish, we will be increasing the package so that, as you said, kill 2 birds with the 1 stone.
And we'll have more for you on Speak Your Mind. Hey, welcome. We welcome your calls. Feel free to call us up, 3220-906 or 907, or text us on 825. Welcome back to Speak Your Mind. Yes, continuing with our conversation with the VCSA Sai Health Center representatives. Now, Doctor, what can you say? What did the team learn from these outreach clinics when you did kickstart the project?
I think there is a huge gap in clinical services, particularly for rural women and girls. And the model that the outreach clinic has shown me is that this service is worth the effort and worth the resources. Initially, people might think that the resources involved in reaching out are fairly high, but I think the returns and results in terms of impacting on health is very significant. Fiji's population is relatively small. The urban populations are reasonably well catered for.
That's true.
The rural populations aren't.
Not so much.
And with the high poverty levels, particularly in the rural communities, people find it very difficult to even have the bus fares to access health centers and hospitals. So I think that's one thing. The other thing that we've come across is there is a lot of basic misunderstanding and ignorance on matters relating not only to sexual and reproductive health, but also in relationship to non-communicable diseases. So I think the ministry and we, the NGOs, need to work together in reaching out. I think here's an opportunity for partnership, because one group on their own will not be able to provide the services required, but together, collectively, cooperatively, collaboratively, I think we can make a much bigger impact. And what we would be able to do that way is also consolidate resources.
True.
Resources aren't easy, and what little resources we have shouldn't be wasted. They should have high yield. So I think what Visesi has learned in the last 2 years, that it is possible to have public health interventions provided in a cost-effective manner, targeted in such a way that the net yield is maximized, and also to work as collaboratively as possible with other sectors within the community. So those learnings, I think, have been important. The other thing that we're even more convinced by is that empowerment and building a resilient community is the way to go.
That's true.
I think the health message of teaching people about health in hospitals is too late. The right time to start is in primary school or even earlier. And I think over a period of time, I hope we're able to contribute towards gathering enough information and data to be able to inform policymakers about new directions in preventative health and primary health care. So the learnings at Visesi have been very rich in the last 3 years since we've started. And I hope we have continued opportunities to learn more and contribute to policy directions.
Nice, true. Now, with the sexual reproductive health education that you took in this program, did you also conduct family planning procedures with the ladies in the rural areas?
Yes, the team that goes out has access to family planning services, and there are intrauterine device insertions, but the major issue is advice and dealing with issues where people are confused about what is the appropriate contraceptive for them. I mean, there are a range of contraceptives available, and one can customize a family planning approach for the individual person.
Were the ladies welcoming of this though? Because seeing as they, like you said, it's very hard for them to come into the urban centers or go to the health centers to get family planning done. So they must have been very welcoming when the health clinics did come over.
I think the fact that the team is led by a gynecologist, has a strong clinical base, provides privacy and confidentiality, and that the education team is a separate team but working in conjunction, means that most of the women have had a greater sense of confidence. But yes, there is shyness, and many barriers need to be broken, and it takes a while to break those barriers.
True. For the, like I mentioned earlier, with when it comes to family planning contraceptives, some people get this misconception about certain procedures. Now, can you tell us a little bit more about why the misconception, especially when it comes to the loop or the other contraceptives? A lot of them believe that this is what causes cancer, just to put them at risk. Can you tell us a little bit more?
Well, much of this is gossip and people talking about half-truths. But something that saddens me a little bit is that I think our own health professionals are often guilty of initiating the misconceptions.
Sure.
and these misconceptions should not really occur. So, for instance, yes, there is an association with virtually everything that we do and prescribe, and some potential complication or risk. But if one were to look at all this in balance, the net gains are much, much, much greater.
That's true.
So, some common myths. Do intrauterine contraceptive devices cause cancer? No, they don't.
Okay, well, there you go. We will continue with this discussion, so don't go anywhere. Feel free to call us if you can, 3220-906-0907, or text us on 825. Welcome back to Speak Your Mind. Yes, our final segment for the day. Now, Dr. and Mosese, just looking at some of your numbers, the number that was found to be abnormal, or during the total number of women screened during pap smear and breast examinations, was over 4,000 and almost 5,000. Now, with the team that you took, and also with the allocated days that you did go do the outreach clinics, do you think that was enough being done, or you think there's still a whole lot more that can be done for these outreach clinics?
Let me just correct you. The 4,000 weren't abnormal. They're the pap smears that were done.
Yeah. Abnormal,
and only
29.
a small portion of those would be abnormal.
Not that, yeah,
But,
of course. Thanks
but on the other hand, doing pap smears is one way of reducing cervical cancer rates. And internationally, it's been found to be very useful. There is some discussions happening in Fiji at the moment as to whether this is the most cost-effective approach. And there is a project being piloted which involves visual inspection of the cervix using vinegar. But those discussions will continue. In the meantime, from Visesi, we've felt that one way for us to go at the moment is the pap smears. Now, you're asking whether this is enough. Obviously not. This is almost like a pilot. What we really need to do is reach out to every woman who's at risk. And when we're talking about every woman who's at risk, about 2 to 3 years after first sexual exposure, a woman should have a pap smear every 2 years. Until such time, until about 5 years prior to her death. So some people could argue that a 2-yearly pap smear program is too expensive.
Yeah.
Then you could start targeting doing pap smears on a one-off basis for all women aged around about 30, 35. And that is one strategy that could be used. But I think the important thing is that all women who are in that category need to have access to some screening program, because cervical cancer is a terrible disease to have. It's a disease that affects youngish women. We see women in their 30s and 40s dying of the disease because it's progressed to an extent where it can't be cured. There is no radiotherapy facility in Fiji. So the only way of curing cervical cancer in Fiji is either picking the disease before cancer happens, or picking cancer very early. Fiji has one of the highest rates of death associated with cervical cancer in the Pacific and probably in the world. So it's a major disease and a major problem, and we have limited facilities in Fiji to deal with it.
Nice. There was apparently 29 were found to be abnormal with high-grade lesions. Now, for when you say you refer them, do you also do a follow-up program with these patients?
Yes, one of the strengths of the Visesi program is that all pap smears that are done, we're able to get the results and chase up those women who've had abnormal pap smear reports. And in some circumstances, we've spent 2 days trying to find the woman involved.
Wow.
And we have succeeded. These women are then referred to Lautoka Hospital for either colposcopy or more definitive treatment. And both Professor Naidu and I work at Lautoka Hospital, so it makes the follow-up easier.
True.
But yes, we are able to follow up the pap smear results and ensure that the women with abnormal lesions are appropriately managed.
Nice. Now, you also conducted youth workshops, Mosese. Tell us a little bit more about this. What youths were you targeting?
Well, we were targeting mostly out-of-school youths, those who are in the later adolescent stage.
Mm-hmm.
And we worked with the Ministry of Youth in organizing these specific trainings in Nandi, Lautoka, and Ba. And the whole idea was to empower them on reproductive health information so that they can make informed decisions and informed choices as well. And also to highlight to them what's the status quo of the reproductive health status of women in Fiji at this point in time. What we found out from these trainings is that there is still a lack of knowledge. I think this is perhaps one of the gaps and are going to be continuous gaps in future to come. And part of the project is also to research on the knowledge, attitude, and practice of people regarding sexually transmitted infection and family planning information. And for that, by the end of the project, perhaps we will have a fair idea on this. But my gut feeling tells me that the level of understanding amongst young people in regards to reproductive health is still needs to be looked into. When we look at the number of teenage pregnancies, we look at the stats of sexually transmitted infection. The majority are young people, and even for HIV and AIDS as well, the numbers for young people is quite high. So it also tells us that there needs to be a lot of intervention to young people in terms of education.
That's true.
And that will not only be from BCC Sai Health Center, that will require the Ministry of Education, that will require the Ministry of Youth. It also will require the assistance of the Ministry of Health and all broad-based organization who deals with sexual and reproductive health matters. And we really need to turn the tide now.
That's true.
Otherwise, it's going to be a devastating effect into the economy of Fiji, the social development of Fiji, and so forth.
Doctor, what are the plans for the VCC Sai Health Center? Now you've conducted this project, you've seen the outcome, you've seen the benefits of this. What is the plans now for VCC Health Center before we wrap up?
We're very grateful to the European Union for funding the empowerment program. And we're also very grateful to the Fiji Community Development Program for the NCD projects. Both these come to an end later on this year. So we are trying to see how we can source resources that would allow us to continue this work. We've learned that the work is important.
It is.
We now need resourcing to make sure we can continue.
Well, if you are listening and you think you can help the VCC Sai Health Center resource these projects, please feel free to call our guests. But yes, before we go, gentlemen, any last words before we wrap up the show?
Well, I would like to thank the Songo Marama in the province of Ba for agreeing to work with us in terms of our health outreach, and also to the Ba Provincial Council in recognizing the need to live a healthy life. And to the people of Bunta and also to the areas that we are serving within the Nandi, Lautoka and Ba corridor, we are there to serve you, and our ethos, as already been mentioned, is love all, serve all. If you do have any questions regarding reproductive health or NCD for that matter, you feel free to call us in the VCC Sai Health Center. We have the specialist for gynecology. We have the specialist for the intervention on non-communicable disease. And we have people who can come in and talk about wellness in the community. And if people can just live healthy, keep fit, do the right thing, don't smoke, don't do the don'ts, and
do the do's.
And do the do's. Be safe.
Okay, thank you so much. Well, thank you once again, gentlemen, for making it to the show. Until next time.
Thank you.
Minaka. Well, that was Speak Your Mind for me this season. Until next week, Edwin will be joining you for Speak Your Mind. Until then, you have a great day.